Because of this government's decision, it is no longer illegal to smoke crack, meth, or shoot up heroin in public spaces in British Columbia like parks, hospitals, and public transit. The British Columbia government has now begged the Prime Minister to reverse this decision. So, simple question, when will the Prime Minister once again make it illegal to smoke crack in a hospital room? Just the date.
This government is supposed to be in the business of protecting children, not killing them with exposure and access to hard drugs. The RCMP has confirmed that legal hard drugs are being sold on the black market. In Abbotsford, the Soccer Association has to regularly sweep the needles for pitch. The Legion and many businesses in Mission have to deal with crack smoke every day. When will this government do the right thing and cancel their ideologically extreme experiment to legalize hard drugs and start protecting BC's children?
Hear, hear. The Honourable Deputy Prime Minister and Minister of Finance.
Mr. Speaker, as a mother of 3, including teenagers, I care so much about Canada and Canadians, and I agree, opioid addiction is a tragedy. It is a public health tragedy, and it is a public safety tragedy. But let me tell you what is putting the public safety of all Canadians at risk. Consorting with white supremacists and misogynists. That is a public safety risk. The Conservatives have an opportunity today to disavow that. They should do it.
Dangerous drug policy in BC allows people to smoke crack on a public bus, to shoot up next to a park with people with children playing there, to blow smoke from meth in the face of a nurse in a hospital. Now we learn what the Liberals want to do to Toronto, what they've done to BC. The Leader of the Opposition sent the Prime Minister a letter asking him to reject Toronto's request. Are the nurses in Toronto getting people who smoke meth in hospital rooms, or will they finally reject the request? Speaker, their plan is killing 22 Canadians every day, and opioid deaths have doubled in this country in just 2 years. I can't believe that the Minister from Toronto wants to expand this lawlessness into her own city. Otherwise, she would just say no. I'll give her an opportunity to just say that. One more opportunity to stop this extremist experiment on the streets of Toronto. Yes or no? Will you reject it?
The Honourable Deputy Prime Minister and Minister of Finance.
Mr. Speaker, I'm a minister, I'm a Toronto MP, I'm a Toronto mother. I know, as everyone in this House should, that the opioid crisis is a tragedy, and there are no families in Canada that are untouched by it. The BC pilot project was requested by BC. BC has serious concerns. We share those concerns. We are addressing it. There is no other pilot project anywhere in Canada, and the BC experience should and will be instructive.
Completely committed to working with communities across this country in facing the opioid crisis and the tragedies that are happening to so many families. Every request is reviewed on a case-by-case basis. The member should know this. Toronto Public Health has not submitted a proposal that adequately addresses the dual objectives of public health and public safety, which have guided us throughout addressing the opioid crisis. Every level of government, including the province, must be engaged in this process, and we continue to work together.